John.
Hi, my name is Michael Johns, and I'm performing the insertion of nasogastric tube, also known as the NG tube. First step is to verify the physician's order, verifying insert NG tube, verify placement per agency protocol, feed 1 can full strength isosource every 4 hours. Also, assess for allergies or contraindications for patient having procedure. There is none, so nothing for me to do. Gather equipment and take it into the patient's room. Awesome. Identify patient using at least 2 identifiers. Awesome. Unless contraindicated, place patient in high Fowler's position. Which is 45 degrees or more.
I just was like saying her date of birth, and I was like, oh, okay. She's like, you forgot my birthday. And I was like, no. May 20th.
Alright, that ought to work. Perform hand hygiene and put on clean gloves.
Let me say this. She was already up.
Gloves are on.
Put her up in the right position.
Assess condition of patient's nose, example, deviated septum. Alright, nope, everything looks good. And now I'm going to determine the length of the tube and mark it. This I do know how to do.
Every Saturday.
Hold on 1 second.
I read all day.
All day?
That's what I feel like.
So what? I think this one goes in. So, I don't know. This one was in when I got here. I'm trying to get all this tape off.
I don't think I'm gonna fake. I'm gonna try to do as much as I can.
Yeah, same here. Sorry for the delay. Alright, so I assess the condition of the patient's nose, and I'm going to determine the length of the tube and mark it. Okay, so I'm going to start at the nose, go to the back of the ear, and then go all the way to the sternal notch right there. So
The sternal notch?
not sternal notch, the
Xiphoid process.
xiphoid process. Mark it with my thing.
It was up here though.
It's like right here.
Okay.
Yeah.
I guess.
Yeah. Alright. After that, I'm going to lubricate at least 4 inches of it. Do I have a little thing for that? I guess I could just do it over a trash can. Lubrication. Or I'll just simulate it. I wouldn't actually do it. Lubricate. I don't think we're actually...
Does it say?
It says it's important. What?
I was just trying to see if it said verbalize.
No.
Okay, then I guess we're really doing it.
Pretty sure you don't.
Yeah, I'm not going to open up the lube and do it. I like...
Isn't that what Miss Olsen did in that video?
Yeah. They're not going to... It's going to be a hot mess for them if they have to do that.
Yeah, to have to clean it after every person.
Alright, Mr. So-and-so, I need you to tilt your head backwards for me. And I'm going to gently insert the tube, point through nares, aiming downward towards patient's nasopharynx. Alright, once I feel resistance, apply downward pressure and rotate tube. I'm just going to verbalize all of that. Like, I don't, it's, how do you show that?
If you do not say that.
Yeah. Okay, so when the tube breaches the nasopharynx, like, I'm guessing it has. Like, how do we know this?
Jessica.
I mean,
Oh, that's
I'm talking
right.
about for the purposes of this, though. Alright. This is mostly just talking through it and, like, okay, so if the patient gets a gag or choke, I'll stop it and then encourage the patient to take slow, deep breaths. Advance the tube, and I'll also encourage the patient to swallow. With each swallow, I'll advance the tube a little bit more. A little bit more, a little bit more. I hope this goes far enough. Swallow, 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 swallow.
I mean, you know.
Swallow, 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 swallow. Alright, cool. Thank you.
How you know?
You marked it, yeah.
Oh, yeah, I marked it. Since this is for feeding, I'm going to confirm the placement using x-ray, send them down to the x-ray room, whatever, prior to starting feeding or medication, and I was ordered to feed 1 full can of strength, so I'll connect my syringe here.
Other end of the tube.
Huh?
Yeah, that's
Oh my goodness, thank you. That's not even it's not even, feeding them's not really even on the list though, that's the thing.
You know, the main thing is just
Like,
don't have so much tape that it drive you
good.
Can I make another suggestion, Michael? Don't pull the stop. Don't pull the end of the syringe off once you stick it on there. You just pulled out all the crap out of their stomach.
Oh yeah.
No, this feeding them's not even on the list though, that's the thing, like.
What do you do?
No, it's not. It just says, if used for initial feeding, you're just supposed to verbalize this. If using, for verifying tube placement, if being used for initial feeding, confirmed placement by X-ray, ordered by physician, or required by facility, prior to starting feeding self-medication. It doesn't really say. You know what I'm saying?
Yeah, but you do the same thing for feeding that you do for medication. So, but she said there wouldn't be.
We're not gonna have medication.
Exactly. So
Well, could you?
we're gonna have feeding.
But where would I get a mark off for if I didn't touch this the entire time? Where would I get marked off of?
Okay, what
On the
y'all
list.
say about the needle? What do you do with
Do
the
you get what I'm
He
saying? Then?
popped this out and he had this in there, so he's
Yeah.
drawing up everything that's in the stomach. Does
Small
that make
nuance.
sense?
Yeah.
And the thing is, it's not on there, so that's what he's saying.
So he was aspirating?
Yeah, I was saying I was ripping out his insides.
He aspirated. Does that make sense?
No, this is my first time actually doing this. Yeah. So I
I don't think it matters. Does it?
secure tube. See, that still doesn't make sense though. I wouldn't feed yet at that point either. I would have to secure it.
That was my question earlier.
That's why I don't think we have to feed them during the procedure. Maybe at the very, very end, just so you don't miss it.
Okay, what
But-
you gonna come and you're gonna take that to the patient?
So I would.
Okay, this one.
This is the method that somebody was telling me about. Go around right there.
Yep.
Some instructors are real sticklers and some aren't.
Or you can do the double.
Secure
one.
tube.
Yeah.
Oh, I should have put this on the patient from the get-go. That's something else that I missed.
Okay, but then what did I do when y'all said the needle? I still didn't see it.
Oh, okay.
I want to see what you did wrong, so I want.
Are we gonna actually have to feed them, or is that
This was already on there, and then I pulled it out.
You're not supposed to do that because that's drawing stuff out of her.
just got all
And you don't want to draw anything out of her.
So you're supposed to just keep it right there.
Well, no,
You're supposed to take it out
this,
before.
And then,
taping is
let's see.
Take that off, then
And-
get on it, and then pour the food in.
See, I wouldn't put in food there because I would have to secure it first. That's the thing.
Then you just
Do that right there. There's nowhere on here where it says actually do the feeding for that. Is what I'm saying. But okay, so you're saying that I would feed the patient before I even secured it after that next step? That doesn't make sense to me. For
Why would
that.
you secure it soon after you put it in there?
Say what?
okay. For the sake of time, can we just finish this up?
Yeah,
Before my
okay,
phone
sorry.
goes dead?
Dispose of equipment, so I'm just going to throw away all the stuff that I don't need. Leave patient head of the bed elevated and comfortable. I might just lower this a little bit. Document procedure.
the reason it's there is that you have to.
That's just verbalizing it. Document procedure, patient tolerance, characteristics of drainage or tolerance of feedings. Continue to monitor patient. Document report any unexpected outcomes, corrective measures taken, and outcome.
Okay. Thank you, and we'll
No
figure
problem.
this stuff out in a second.